Hey guys, so my name is Gwen Fifield, and today I'm going to be talking about surface anatomy, and we're going to be going over different areas of anatomical surface features that you can see on a human body. This is my twin sister, Alana Fifield, so I'll be showing you on hers. And so what surface anatomy is it is the study of anatomical landmarks on the exterior of the human body, which is important for being able to describe the location, appearance, and relationships of different anatomical features you can see, as well as for medical procedures, so that way you know the correct location of certain bodily features. And so to start, we're just going to be looking at a few surface anatomy features that you can see. And the first one is we'll start up on her cranial region. So this big bone right here is your zygomatic bone, or also called your cheekbone. That is part of your skeletal system, and it plays an important role of chewing or mastication, because there's a lot of muscles that will attach up to that bone to allow for the movement of chewing. And then next we'll work down into the thoracic region, which is the chest region. And this bone up here is her clavicle bone, which you can see is the protruding bone right along right there. That again is part of your skeletal system, and it plays an important role in movement of the shoulder. And so the clavicle bone will attach to the scapula bone back here, and those together help form the joint for your arm, and it help allow some of that movement there, because a lot of muscles from the arm will attach over there. The two, scapula and clavicle joint, also allow for just movement of the shoulder. And then we'll make our way down to her abdomen region, but we'll go on the back side so you can look at her vertebral column. The vertebral column is all the vertebrae that make up her back. Up here you've got the cervical, thoracic, but then there's the lower lumbar region, and so there's 5 vertebral bones in there. And so that again is part of the skeletal system, and what your spinal column and vertebrae help do is support your central nervous system. So your spinal cord goes back through your head and down the back of your vertebrae, and so those bones help encapsulate and protect it. It also has a huge role in the support of your body, holds all your weight of your body. It's also a balance focal point. So her spinal cord has a huge role in just keeping a human upright, as well as protecting that central nervous system nerves in there. So a couple of clinical procedures that can occur at this place is an epidural. So in the space between the vertebrae and your spinal column, there's a little pocket of space called the epidural space, and you can inject an anesthetic in that area to numb the nerve so you feel less pain. It's a common procedure during childbirth. That's also a popular region between the L4 and L3 and L4 and L5 vertebrae. And that is a spinal tap, where you take out a little bit of fluid from that area. And that's from your cerebral spinal fluid to test that out. Okay, and then moving over into her arm area, you can see a network of veins that comes through down here. One of the most common would be your cubital vein, which is this inner one over here, and that's a really important site for withdrawing blood. So the veins are part of the cardiovascular system. The veins are returning from the hand back to the heart, because it's deoxygenated blood where it needs to go through the heart into the lungs to get oxygenated again. So all this is doing is carrying blood up here, but this specific region is important for drawing blood, because it's close to the surface, easily accessible, as well as there's not too many nerves around here. So that vein you can see and is a prominent part for drawing blood. And then lastly, we'll move down to the legs, and you can see over here she's got her gastrocnemius muscle, which is part of your muscular system. So there's 2 heads, both the medial and lateral. So those muscles play an important role again with support and movement. They have a big role in flexion and extension. So the movement of the lower legs and lower limbs, a lot of it stems from the muscles in her calf muscle. And so those are just a few of some anatomical features you can see firsthand. But if you have any questions, please feel free to leave them below. Thanks so much.